Hello, my name is Ed Bottomley from the Michigan Medicine Department of Communication, and I'm going to be your host for today's live stream on COVID-19. I'm joined by our expert, Dr. John Ayanian, who is both a primary care doctor and a health policy researcher. He leads the University of Michigan's Institute for Healthcare Policy and Innovation, which involves 640 faculty from across all three U of M campuses who are working to make healthcare and health policy better for everyone through data-driven research. He's also a general medicine physician who focuses on the care of people who have multiple chronic conditions. And he has been involved in Michigan Medicine's massive response to the demand for general care in the time of COVID-19. Now, if you're wondering about our new setup here, well, out of respect for social distancing, we'll be doing this live stream remotely. So pardon any technical interruptions. We're going to try and keep this going. Dr. Ayanian and I have been practicing this beforehand, so everything should be pretty smooth. If not, we'll keep the ball rolling with some questions. First, a few housekeeping items. You can submit your questions at any time, even now, for Dr. Ayanian to answer during the Q&A portion of today's chat. Questions can be submitted in a number of ways. You can comment on this video, but please note that if you do so, your name or your profile name will be visible to others participating. If you prefer a more anonymous option, you can send us a private message via Facebook, or you can email us at ask-mishmed@med.umich.edu. Sorry, I had a frog in my throat there. ask-mishmed@med.umich.edu. If you can't stay for the whole chat, or you want to share a recording of this with a friend, a video of this in its entirety will be available on our Michigan Medicine, University of Michigan, CS Mott, and Employees at Michigan Medicine Facebook pages. It'll also be up on our UMich Medicine Twitter account and our Michigan Medicine YouTube channel. So, housekeeping out of the way, let's move on to our questions with our expert, Dr. Ayanian. Questions for you. Let's start with the basics and current guidance here, Dr. Ayanian. Michigan is under an emergency order, as are other states, and people are asked to stay at home except for essential trips. Can you remind us just why this is so important?
Thank you, Ed, and good morning, and welcome to everyone joining us for this conversation today about the COVID-19 pandemic and how we can all work together to do what will be required to make sure we get through this as a community and with the best health outcomes possible. We're now in many areas of the country being strongly advised and in some places required to remain at home, to limit our trips outside the home to just essential trips for shopping or to pick up medications at a local pharmacy or to receive medical treatment for an urgent or emergent problem. We're doing this because as a society, we need to flatten the curve. And that means our healthcare systems, particularly in some of the cities that have been most affected by the coronavirus, so Seattle, New York City, now Detroit, where there's been a sudden surge of people needing hospital care and particularly intensive care. That sudden surge is placing enormous demands on our hospitals and the intensive care units that they normally provide for people all the time who have heart attacks or strokes or major accidents or major infections. We now have a sudden demand for people developing severe pneumonia, some of those most affected by the coronavirus. And so we need to try to reduce our contact with others so that we reduce the spread of this very contagious virus. And that if people do get sick with it, it happens at a slower rate, at a rate that our hospitals and emergency departments and intensive care units can handle, so that we are sure to have the resources that everyone needs to get through this crisis.
Thank you so much for that answer. The next question we're going to move on to is, let's talk about how to recognize and deal with the symptoms of COVID-19. What are the symptoms people should be looking for in themselves and in their loved ones? And what should they do if they start experiencing these symptoms?
Well, the three most common symptoms to be watching for are fever, so a fever above 101 degrees, a cough that persists. Often it's a dry cough, but can be fairly severe. And then the most worrisome symptom is shortness of breath. If you or a loved one, a family member or friend develops severe shortness of breath in the setting of a fever or a cough, that would be a reason to consult your medical provider immediately, or present to the nearest emergency department if that trouble breathing is severe. So those are some of the most important symptoms to watch for, and the most common ones with the coronavirus. Other people sometimes experience headaches, significant muscle aches, and fatigue. There have been some reports about people, even without other symptoms, losing their sense of taste or smell. So we'll be watching. We'll need more research to understand whether that's a direct effect of the coronavirus or not. And then in some cases, we've also had patients experience what we call gastrointestinal symptoms, nausea or vomiting or stomach aches or diarrhea. Those are less common, but may be part of the presentation of coronavirus for some individuals.
Thank you very much for that answer too. Let's move on to our next question. What should you do if someone you live with has symptoms? Is there a kind of distancing that you can protect within the home to protect others?
Sure. Well, the Centers for Disease Control and Prevention, the federal agency that's helping us to manage this coronavirus pandemic, has good guidance on its website for people who are concerned about a household member who may have the coronavirus infection. It recommends, and we in the medical community are recommending, that if your symptoms are not severe, if you have a mild fever or a cough but no shortness of breath, that you try to isolate yourself as much as possible at home. Within the home, set up a separate bedroom if possible for the person who may be experiencing symptoms of the virus. Try to maintain at least a 6-foot distance from people who may be coughing in the setting of this infection. We know that that's the main way that it's spread, by being near someone who's coughing, or by touching a surface that someone with the coronavirus has recently touched, such as a kitchen counter, a faucet handle, a doorknob. So as much as possible, try to keep those surfaces clean. And the CDC has very good guidance on their website that I believe we can post with this live chat to provide better information about how to keep your home as safe as possible if you're living with someone who either has the coronavirus infection or may have the symptoms that indicate an infection.
Thank you for that. You're absolutely correct. We can push these links out in the chat section of these chats. The next question, what are the symptoms that should prompt someone to go to the emergency room or urgent care? Should they go without talking to their doctor or their other regular healthcare provider first?
Whenever possible in the setting of this infection, it's best to call your regular healthcare provider, your primary care physician or nurse practitioner or others who knows your medical history. Describe your symptoms to them. If you mainly have fever and a cough without significant shortness of breath, if you're not feeling lightheaded like you might faint, you can safely stay at home and drink plenty of fluids, get rest, take something like acetaminophen to control the fever or headaches or body aches that you may have. But if you or someone in your home or someone you're close to is developing significant shortness of breath, or if they're feeling like they may pass out, they're feeling very lightheaded because they can become dehydrated from the fever or not taking enough fluids. Those would be more urgent situations where you should call immediately for medical advice. And if the symptoms are severe, present to your nearest emergency department. But we all are recommending that people call their medical providers first, because if you can manage safely at home, it's actually better for people who may be experiencing these symptoms to stay at home if they can and not be exposed to others in the emergency departments or to expose other people in the waiting rooms there. And we really want to preserve and keep the emergency rooms open for some of the most severely ill patients who need that care most immediately.
Thank you. Thank you. Another good answer there. And thank you for answering this wide variety of questions. The next question we have up: what is considered a pre existing condition that would put someone at higher risk of these severe symptoms?
Well, we know from some of the early research that's come from the epidemic in China and in Italy, and we're now starting to see these findings confirmed from the United States, that individuals who are older, typically over age 70, or who have chronic medical conditions such as cancer, heart disease, diabetes, chronic lung disease, actually being a chronic smoker appears to increase the risk of lung complications from the coronavirus infection. So those are some of the conditions where the illness can be more severe, people can become sick more quickly. And I would say if you're having symptoms of cough or fever or shortness of breath in the setting, if you or a member of your family has one of those chronic conditions, I'd recommend calling your physician's office or medical provider sooner rather than later to get advice on when it would be necessary to come in and be evaluated, either in a doctor's office or an emergency department.
And thank you for that answer too. The next question we have up for you: we've heard a lot about the shortage of testing to confirm that someone is indeed sick because of the new coronavirus. How will someone know if they qualify for testing?
This is a question that many people have had, understandably so. If we're having symptoms, we'd all like to know whether we've been infected or someone in our home has been infected. Early on in the epidemic, there was a shortage of testing kits, and that made it difficult for everyone who might want a test to get a test. And so from a medical perspective, we've had to set some guidelines for who's most important to test. It includes people with some of those chronic conditions that I mentioned earlier, particularly if they have some combination of fever, cough, or shortness of breath. People living in nursing homes or other group settings where the virus can pass very quickly from one person to another. And then healthcare workers, for two reasons. One, we want to make sure that healthcare workers are not infected and potentially spreading it to patients they're treating while they're providing care. And we also want to keep our healthcare workers healthy as possible and not infected themselves, so they can continue caring for people on the front lines. So doctors, nurses, pharmacists, respiratory therapists, nursing aides, custodial staff who help to keep the rooms clean in our hospitals and emergency departments and clinics. They're all providing vital services on the front lines right now to people who need care. And so it's important to make sure that they get tested as well. But one encouraging piece of news is that the tests are becoming more widely available just in the past 1 to 2 weeks. And I think that will ramp up steadily in the coming days and weeks, so that we may be able to loosen and expand the guidelines that allow a wider range of people to get tested at a wider range of sites. And many hospitals and clinics now are developing drive-through testing services, but it's important to call your provider first to see whether you qualify for one of those tests. Again, because there's a limit on the number of those tests that can be provided and getting the results out quickly. And so we want to prioritize those for the people who need them the most.
Thank you for that, pointing that out as well. This is a slightly different question. As a primary care doctor, what are your clinical days like right now? Are you using new ways to connect with patients that you perhaps hadn't used before?
We are, and that's happening in all parts of the healthcare field. So in primary care, for much of the care that we provide for people with chronic conditions, for example, people with high blood pressure or asthma or diabetes, where we need to see patients on a regular basis to adjust their medications, to monitor their health. Much of that now we're shifting to what we call telehealth, interacting with patients over the telephone and through video visits. And we now have broader authority from the public and private insurers, from the Medicare program, and many insurance companies around the state, where physicians and medical staff can be funded to provide those telephone and video visits, which it makes it much more feasible, and we're developing the technology to make that readily available to patients.
Excellent. Thank you for that one too. For those with underlying conditions like asthma and diabetes that might make them more vulnerable to developing serious cases of COVID-19, what kind of things do you advise them to do to protect themselves and their families?
Sure. Well, people with chronic conditions, along with everyone in society, but especially people with chronic conditions, need to take extra precautions to follow the guidelines for what we call social distancing. So trying to stay at least 6 feet away from other people whenever possible, to avoid contact with anybody who has symptoms that suggest a coronavirus infection, such as a fever, cough, or shortness of breath. And to practice hand hygiene and other recommended practices, washing your hands frequently with soap and warm water for at least 20 seconds, using hand sanitizers when you don't, at times when you can't wash your hands regularly, avoiding touching your face, particularly your eyes, nose, or mouth, because if the virus is on your fingers or hands and you inadvertently touch part of your face, you can become infected that way. So those are some of the guidelines. They're explained well on the CDC website that we're making available with this live chat. And it's important for all of us to be familiar, whether we have chronic conditions or not, because that's how we'll slow the spread of this widespread infection, is if people are following those precautions that our public health professionals have advised.
And thank you for that answer too. We have had a question from the audience. They'd like to know a little bit more about what kind of cough this virus might cause. Can you easily tell a COVID-19 cough from allergies, for instance? What if someone presents with an itchy, scratchy throat with a cough here or there?
Yeah, I think we can't always tell the difference with absolute confidence. The cough with the COVID virus generally tends to be more severe and persistent. It's a dry cough, a fairly uncomfortable cough for many people who are affected by it. Those who have allergies and sometimes get a cough with allergies, it could be watching for other symptoms that may be more typical of their allergies, such as itchy eyes or a runny nose or nasal congestion, which may sometimes be part of a coronavirus infection, but does not appear to be some of the more typical or common symptoms.
Thank you.
I would also mention that a cough in the absence of fever, while it still could be a coronavirus infection, the presence of a fever makes that much more likely to be a viral infection of some sort, possibly coronavirus, rather than allergies, which typically don't present with a fever.
Thank you. I think that's an important addition. Thank you for that. Another audience question. How long after a person is sick with the virus do they have to stay in quarantine once the symptoms have stopped?
The current recommendation is to remain isolated in quarantine, remaining at home, not going out to work or shop for at least 14 days after the symptoms subside. That's another way that we can help to slow the spread of the infection. One of the challenging issues has been that some people, even in the absence of symptoms, can have a coronavirus infection and potentially spread it, which is why we need more widespread testing. But in the interim, until tests are more widely available, it's important for people with the coronavirus symptoms, even if you have not been tested and found to be positive, if you have a fever and a cough at this point in time, particularly if you live in an area of the country with where the coronavirus has become fairly common, you should assume that you could have it and avoid having contact with others, either at home or in the workplace or elsewhere out in the community.
Thank you for that, Dr. Ayanian. Let's talk about health policy for a moment, since that's your other area of expertise. So many patient-provider visits are taking place virtually right now, a major change even since a few weeks ago. What policies had to change at the state and national level or at insurance companies to make this possible?
Well, a number of health systems, including our own at the University of Michigan, have been preparing to provide more services using telemedicine or telehealth and those video visits that I mentioned earlier. Some of the policy changes that help to make that go more smoothly is, or when the federal government through the Medicare or Medicaid programs, which also includes the state government or private insurance companies, issue guidelines and policies that allow physicians and hospitals and clinics to be reimbursed when those virtual visits, those telephone consultations and video visits are provided. There certainly are some parts of medical care where we need to see people in person to do a physical exam, to evaluate their symptoms more closely in person. But many of the services we provide can be delivered effectively through telephone or video contact, and the policies now are starting to make that more feasible. And in fact, in this setting where we want people to stay at home, we're encouraging people to use those services to stay in touch with their physicians and other medical providers.
Thank you for that. Besides Michigan, we're seeing a lot of states and cities and even entire countries enact sweeping orders to try to cut down on person-to-person spread. But then others are not going quite so far. What have we learned from the countries that went through this before us, and how can we apply those lessons to the current pandemic in our country?
Well, some of what we know actually goes back a little over 100 years to the worldwide flu epidemic in 1918, where historical research has now demonstrated that cities and areas that reduced public contact, that implemented measures that we now call social distancing, were able to significantly slow the spread of that deadly flu virus in 1918 and reduce the mortality in the communities that took those measures. And when we look across this current coronavirus pandemic, we see that some countries, particularly South Korea and Taiwan, that were able to institute widespread testing programs and isolate and quarantine the early individuals who were infected with the coronavirus. They were able to contain the spread of the virus much more effectively than certainly we've seen in Italy and other European countries, and as we're starting to see in the United States as well. Now that the virus is spreading in the United States, we need to take the public health recommendations very seriously. To maintain the social distancing, to avoid unnecessary contact with others. This crisis will pass. I know it's a major disruption to the lives of everyone in the country and around the world. But if we can take these measures together and reduce the spread of the virus, we'll be able to get through this, and many people who've been affected by the virus will develop immunity. Hopefully, in the coming months, we'll have a vaccine that's effective, like we have for the influenza infection, and that will help to prevent at least this coronavirus from causing another crisis like we're living through now.
Thank you very much for pointing that out. You've thought a lot in your research about how non-medical aspects of someone's life, like their income, their education, their family situation, and even their access to transportation or fresh food, can make a difference in their health. How could these affect someone's chance of developing COVID-19? Is there anything that policymakers can do to change that?
Well, Ed, you've touched on a field that we call social determinants of health, and this is gaining growing attention even before the coronavirus epidemic. What colleagues and I at the Institute for Healthcare Policy and Innovation at the University of Michigan, and in partnership with colleagues across the country and around the world, are trying to understand is how people's social, environmental, and economic circumstances influence their risk of disease, what access to good quality medical care they have, and how they recover from illness if they develop it, or whether they go on to develop complications of their illness. In almost every case where we look at this, whether we look at heart disease or cancer or major infections or such as HIV, we know that people in worse social and economic circumstances have worse health outcomes. And so as a society, we need to understand why that occurs and what policies would be effective to improve health outcomes, particularly for people with lower incomes, less education, who are more isolated in society because of where they live or the resources in their community. That's going to be a very important way that we understand how this coronavirus epidemic has affected our society, which communities have been affected more severely than others, and what we can do to prevent those negative effects in the future should we face another circumstance like this, as well as how can we do a better job improving health for people across the socioeconomic spectrum to make sure that their outcomes are as good as possible, that both from a public health and prevention standpoint, as well as the healthcare that they have access to and the quality and outcomes of care that they experience.
Thank you for that answer. We are about halfway through now. And we've got quite a few questions to come, so we'll power through some more ones. So I thank you for your expertise today, Dr. Ayanian. Another audience question from someone who was sick weeks ago and is wondering if it might have been COVID-19. They had a virus in early February that presented similar symptoms to what you've described, a fever of 103, dried cough that made their ribs hurt, lethargy. Is it possible that they had the virus before it was a pandemic?
That's an excellent question, and there may be many people in the audience today wondering that themselves. In this time of year in the United States, January, February, March, there are many what we call upper respiratory viruses circulating the community, including influenza, including the common cold, including other viruses that can cause a fever and a cough. Over time, I think we will learn that there were some, if not many people, who developed the coronavirus earlier this year, before testing was widely available, before we knew that the infection was present in the United States. One way we'll, I think, start to get a handle on that is by doing antibody tests. Those tests are not yet fully developed and widely available. But after someone's had an infection, we can do tests to identify whether they've developed antibodies. And that will be an important part of our understanding coming out of this pandemic, is looking at people who were either asymptomatic or had symptoms like the audience member just described prior to the widespread awareness of coronavirus. Some of those infections may very well have been early coronavirus infections. And we may be able to detect that with some of the antibody tests that are currently being developed and hopefully will be available in the near future.
Thank you for that answer there. A member of the audience who has chronic lung disease and has got a pneumonia shot has asked if this might help them. Pneumonia does happen in COVID-19 patients, is that correct? And who should be getting their pneumonia vaccinations? Is this a good time to do that?
Well, there are two types of vaccinations that we commonly recommend in the primary care setting. The annual influenza vaccine, and hopefully many people in the listening audience have already had their flu shot this year. We're nearing the end of the typical flu season, which typically runs from about December through April. So most of the influenza in the community should be subsiding. And then we also recommend something called the pneumococcal vaccine, which individuals can discuss with their doctors. We recommend it for everyone over the age of 65, and we give it before age 65 for people with certain chronic health conditions, such as chronic lung disease. So if someone with chronic lung disease, like the questioner, has had that pneumococcal vaccine, that's highly recommended, and it will protect against a potential complication of the coronavirus infection. People can still develop pneumonia directly from the virus, which we don't have a vaccine for yet. But sometimes when people develop a viral infection, such as influenza and potentially coronavirus, that can lead to a bacterial pneumonia, such as pneumococcal pneumonia. So having had that vaccine reduces that complication, which can be life-threatening for some people.
Thank you again for the answer to that one. We're also getting multiple questions from people with conditions that suppress their immune system, or who are taking medications that suppress their immune system. Can you give some examples of what those conditions and medications might be, and what someone who is in that position should be doing right now?
Well, as we mentioned earlier, someone with any chronic condition that affects their immune system should be taking extra precautions to try and avoid people who have a fever or a cough, and avoid coming within 6 feet of anyone, since at least until this crisis passes, because people who are asymptomatic, we now know, can sometimes spread the infection. So that's maintaining that 6-foot distance and the good hand hygiene, washing hands frequently, avoiding sharing cups or utensils, or cleaning kitchen areas very carefully if you are sharing them with others. Those are important, particularly important steps for people with conditions affecting their immune system. So some of those conditions would be conditions such as receiving active treatment for cancer, such as chemotherapy, having a chronic condition that may affect the immune system, such as rheumatoid arthritis or lupus, having HIV, particularly if it's a more advanced form of HIV that affects the immune system. Those would be examples of conditions where people need to take extra precautions.
Thank you for that. You studied the effects of Medicaid expansion. Many states, like Michigan, have made it possible for more low-income people to get health insurance, while others have not. What difference do you think this will make in COVID-19?
Well, we know from our work in Michigan and colleagues' work around the country, in states that have expanded Medicaid to low-income adults, and that would typically be adults under age 65 with incomes up to about $16,000 or $17,000 a year. Those income limits go up for people with more than one person in their household. We found that access to care improves substantially when people have Medicaid coverage, that people are getting in for primary care, having their chronic conditions detected more commonly. So in a situation like this, where it's very important to know, for example, whether you have diabetes or heart disease, and to be under a doctor's care if you do, Medicaid has helped people to get the primary care they need to have those conditions diagnosed and treated, to get specialty care when they need it. And we're starting to have evidence from individuals covered by the Medicaid program that their health is better, their physical health, their mental health. So I think what we'll now need to understand is how that expanded coverage through Medicaid is affecting people's access to care with the coronavirus pandemic. That is, we don't have answers to that question yet, but it will be an important question and may prompt some states that have chosen not to expand Medicaid to reconsider that decision if we find some of those benefits I mentioned earlier before the coronavirus epidemic are also being seen with the epidemic and helping people to fare better, have better health outcomes if they have that Medicaid coverage.
And I thank you for answering this wide variety of questions that we're pushing towards you. We have another audience question from someone who's seeking advice. Now, this might be a bit outside your expertise. If you can answer it, that would be great. They're asking about how to handle food coming into their house from a delivery of groceries or after they go to the store themselves.
Yeah, an important question that many people are thinking about. Again, I would refer people to that CDC guidance on how to keep your home clean and safe and minimize the risk of coronavirus. They have some guidance there about how to handle food. And it really comes down to keeping your hands as clean as possible. If you're out shopping, wash your hands before you shop, wash your hands immediately afterward, use hand sanitizer during your shopping trips. When you bring food into your home, potentially store it separately. There is some sense that the virus can persist on surfaces for hours to a few days. So maybe putting products that you bring in the home aside for a period of time may be beneficial. But I think it's sticking to those hand hygiene recommendations. And for example, if you're out shopping or handling products that you've just brought into your home, avoid touching your face, in case that the virus is present on a surface like that.
Thank you for your answer to that. Next question up. If you have been exposed to someone with COVID-19 but are not showing any symptoms, what precautions should you take?
Well, if it's a close household contact, like an immediate family member, as much as possible, you should try to follow the same quarantine precautions that your household member is following, and minimize your contact with others. And certainly, if you develop any symptoms, to be aware that they could be the coronavirus. It does not mean that you need to come in right away for medical care. If your fever is not severe, if you don't have significant shortness of breath, if your cough is manageable, you can stay at home safely and just notify your healthcare provider if your situation changes or worsens. That's one way we're going to reduce the spread, is if those who've had immediate contact with others who've had the infection reduce their contact with people who haven't had the infection, and that, as we mentioned earlier, will reduce the burden on our hospitals and emergency departments and intensive care units, because we want those resources to be available for our older relatives, our family and friends with chronic conditions who are at increased risk for developing the most severe forms of coronavirus that can require intensive care, in some cases being placed on a ventilator. And those resources are limited, and we're doing everything we can to expand the availability of those services. But the more we can do to slow the spread of the infection, the better off our whole community will be.
Fantastic. Thank you for that. The next question that we have up is anyone doing a study? Oh no, apologies. We're getting questions from healthy people wondering about what might reduce their ability to fight off a coronavirus infection, or what they can do to boost their immune response. What do we know about the effects of stress, sleep, vitamins, and other things on our immune system?
Well, that's a very broad question, and I think we have some good common sense advice for healthy people to try and stay healthy. That includes getting a good night's sleep. For most adults, that's at least 7 hours each night. Drinking plenty of fluids, avoiding getting dehydrated, maintaining a healthy, balanced diet, getting exercise as possible. Even as we shelter at home, it's still advised that people can go out safely to walk or to exercise for short periods of time, as long as they maintain a safe distance, at least 6 feet from others that they might encounter. So, not to exercise in a crowded area, or to use exercise equipment that others may have been touching that hasn't been cleaned. But getting a good night's sleep, eating well, maintaining your fluid intake, trying to manage stress. This is a very stressful situation for everybody, whether they're sick or healthy. And so doing things that help you to manage that stress, whatever it is. For many people, that's exercise. For some people, it's reading or music. Spending time virtually with family and friends, staying connected. We know that many people may feel socially isolated, and the more that we can maintain connections with family, with friends, with community members, but to do it like we're doing on this live chat today, over the telephone or video chat, that will help people feel connected and to get through this crisis as we expect to do, and to maintain their mental and physical health as we work through this.
Thank you. That was a very broad question, and I appreciate your detailed answer to that. The next question we have up: what about keeping your blood sugar under control if you have diabetes? Does that help someone mount a better immune response?
Certainly maintaining better blood sugar control avoids many of the complications of diabetes, one of which is an increased risk of infection. So, that's something important for anyone out there in the audience with diabetes, to make sure you have an adequate supply of your medications, including insulin, your testing, your material for testing your blood sugar. If you take insulin, the syringes that you need to inject your insulin, because what we don't want is for people to lose control of their chronic conditions in this setting and to have worse health outcomes for that reason because they're isolated. Pharmacies are considered an essential service during this crisis, so there are ways to call for medication refills and to arrange to get those refills, and that's particularly important for people with diabetes so they can keep their blood sugar under good control.
Thank you for that answer. Your work with U of M researchers who study healthcare data to look for opportunities to improve the way healthcare works and the policies that affect it. Are there things you and they are doing right now to help with the COVID-19 response? Are there studies they can do that could improve the response to future pandemics?
Well, that's a broad question, but one that we're paying a lot of attention to now in our research community at the University of Michigan and along with colleagues around the country and around the world. There are different ways we can learn from this pandemic to make us better prepared for an event like this in the future. When it comes to caring for people immediately with the infection, our epidemiologists are helping us to understand how the virus is spreading, who's at greatest risk for needing to be hospitalized, and who might need intensive care. Our clinical researchers are looking at outcomes of people once they're in the hospital. How do we predict whose coronavirus infection may become more complicated? And what are we learning about the different ways that we treat people with coronavirus that may make a difference? Some of that information will come from what we call randomized clinical trials, where there are studies ongoing right now of medications that could be helpful. I think it's important to caution those in the audience today to not take medications based on what you read in the news, because they might be helpful in preventing or treating coronavirus. It's very important that be done in consultation with your physician or other medical provider to make sure that is the right treatment for you and that it's safe, because we don't want people to take medications on their own and then develop complications which could be as severe or more severe than the coronavirus itself. And other ways that we're studying this epidemic, we're going to be looking from a public health perspective and a community health perspective, which communities were most severely affected and why, which communities were resilient in the face of the infection, and what can we learn about what helped them to be resilient. I think we'll learn more about how our healthcare system functions as a system and some of the challenges we face. For example, in cities that have been particularly hard hit by the infection, where we may have hospitals in multiple different healthcare systems, how can those hospitals collaborate and coordinate care more effectively? So if one hospital is becoming full with coronavirus patients, that other patients can be cared for at neighboring hospitals most effectively. Those are some of the important questions that we'll be studying from a research perspective and hope to get answers as soon as possible to prepare us to deal with the next public health crisis or emergency more effectively.
Thank you. And then we have a question here that ties on to this. Would some of those studies that you've mentioned be able to address something that some audience members are asking about, whether certain characteristics of people might mean they're more mildly affected by COVID-19? Characteristics such as DNA, past illness history, lifetime travel history, health history, etc.
That's a great question, and the questioner is someone we might want to bring on as an advisor to our research teams. Yes, we are going to be looking very carefully, we and others, to try and understand what factors may have increased some people's risk and what factors may have been protective. Why with this sudden spread of this coronavirus, why did some people become critically ill quickly while others became infected but without any symptoms? And what is it about some of those factors you mentioned, their own biology or genetics, their health history, the environment in which they live, the kind of work they do, some of their health habits like smoking or alcohol use, all those will be important factors to look at, as well as community factors. Were communities where more people live in poverty affected more severely, either because people live in closer quarters or for other reasons, because of the environment or the air quality, for example, where people live. And we won't have all those answers quickly, but they're important questions to raise. And over time, I think we'll have a much better understanding of why some people became more ill and others did not with this coronavirus infection.
Thank you very much for that answer. We're also getting some audience questions about what's happening with COVID-19 cases and deaths in our immediate area, in Detroit and Wayne and Oakland counties. Can you comment on what our region is going through and what that means for those of us who live near this hotspot or another city that currently has a large number of cases? Do you think that we will perhaps need to be following social distancing for longer than currently predicted? Sorry, that's a long question for you there.
Yeah, no, it's an appropriate concern, particularly for people who live in areas that are developing higher concentrations, higher numbers of people infected by the coronavirus, and and there are websites available through Johns Hopkins and other organizations that are tracking the spread of the virus. Here in southeastern Michigan, at least the data as of today suggests that Wayne County and the city of Detroit has the largest number of patients infected with coronavirus, followed by Oakland and Macomb County. But in most other counties across the state, there are at least some cases of coronavirus. So there is a risk of it spreading, as we've already seen over the past 1 to 2 weeks within the city of Detroit and the nearby areas to Detroit. So I think people in those areas are especially need to follow the guidelines from their governors and mayors to maintain social distancing, to stay out of work, and unless they're designated as performing an essential service, such as a healthcare worker or police or firefighter, and to do everything they can to stay healthy, to slow the spread in their own communities. Because the areas that have been more severely affected, such as New York City, Seattle, and now Detroit becoming increasingly affected, in those areas, that's where the hospitals are most severely strained, and having the greatest challenges in terms of meeting the needs for people with the more severe forms of coronavirus. Within regions now, and with support from our state government in Michigan, we're now working to manage that sudden surge of patients and to make sure people get the care they need, even if it means they need to be moved to a hospital that still has more beds available and more intensive care resources if needed.
Thank you. That was we've been throwing a lot of very broad, complicated questions to you. You've been jumping all over the place. I really appreciate your expertise. Looking ahead, we have a question from a parent of a University of Michigan student who's decided to stay in town and continue their classes online from Ann Arbor. The parent is wondering if they'll be able to drive to Ann Arbor to pick up their Wolverine at the end of April. They are well and have been staying in place.
So it sounds like the student of that parent is following the advice that we're recommending. Several weeks ago, all the classes at the University of Michigan were moved to an online format through the end of this semester in late April. And it's under the current circumstances, if this parent needed to come to Ann Arbor to pick up their son or daughter, that would be safe as long as neither one of them is sick. But they should be, very careful in following all the recommendations we've discussed around hand hygiene and and paying close attention to symptoms. Certainly by the end of April, the situation could be better or worse. So it's, that's a month from now. It's difficult to predict whether the restrictions that we're all living with now will be loosened or tightened at that point. Hopefully we'll be past the worst of this epidemic and some of the restrictions can be loosened. But it's important for everyone to take those restrictions seriously now when we're still in the midst of the height of the epidemic, particularly in southeastern Michigan.
Thank you for that question. We have another. It's more a series of statements that we've been seeing coming through on our live chat. We're getting a lot of people just saying thank you for doing this chat, and I think we're hearing thanks for all of our healthcare workers at U of M and also across the country. What can we do to support our healthcare workers and keep them safe as this continues?
Well, in many communities, including here in Ann Arbor, there have been calls for people, either because of their jobs or supplies they may have at home, of things like face masks or gloves that can be used to reduce the spread of the infection. Our community and others have set up opportunities for people to donate supplies, and we've had a great response. For example, from some companies that use the protective masks in their work sites, and while they're not working now, they don't need those masks, and they're offering them.
It looks like, I'm not certain, but it looks like Dr. Ayanian might have frozen for a second. And this is something that we've seen before. The chat was going very smoothly until then. So I think he just needs to refresh the page and we should get back on board with Dr. Ayanian pretty quickly. And I think we have him back momentarily. Thank you, everybody, for staying on board as we navigate this slightly different situation from usual. Let's see. And I see the screen spinning. Dr. Ayanian, welcome back.
Thank you, Ed. I think one of the challenges of our virtual connections that sometimes we get breaks in our those connections, but yes, I'm back. And maybe you could just let me know where I was when we cut off, and I'll try to pick up on answering that question.
You were talking about the donations of face masks from workers who perhaps aren't using them right now.
That's right. So I was mentioning it here in Michigan, a number of companies and some individuals who use face masks or protective gloves in their work and don't need those supplies while they're not working, have responded to requests for donations from the University of Michigan or other local healthcare systems to donate those supplies. And we are making good use of them. As those who've been following the news know, the role of personal protective equipment, or PPE, is an essential part of our healthcare for people with coronavirus infection. It's the way we keep the healthcare providers, the doctors and nurses and aides and others who come in direct contact with patients. We keep them healthy and reduce their risk of developing the infection and having to take time off from work or spreading it to others. So that is an important component. And I was also mentioning that what people in the community can do to support their healthcare workers is to follow the public health guidance closely, to maintain social distancing, to help flatten the curve so that hospitals and emergency departments are not overwhelmed with severely ill patients. If we can enable this epidemic to spread more slowly and ultimately burn out, we'll get through this together, and we need the whole community following those guidelines in order for our healthcare system to meet the demand and get our patients through it as effectively as possible.
Thank you so much. Thank you for being on board for today's chat. I think we've gone through all our questions, but I want to make sure as we come to the end of our chat, Is there anything you think we've missed? And do you have any takeaways for our audience?
Well, I think we've covered what I would say are most of the important points for members of our community to know. I would just emphasize the importance of following the recommendations for social distancing and for personal hygiene, frequent hand washing, avoiding touching your face, using hand sanitizers, and washing hands well with soap and water. And for people with symptoms, if they're not so severe that they feel they have to go immediately to an emergency department, symptoms of fever, shortness of breath, or cough, to call their healthcare provider, particularly if they have any chronic conditions that also affect their health, to get direct advice from a doctor or nurse who knows them or knows their medical history from their medical record about whether they need to come in to be tested, whether they need to be evaluated in a doctor's office or an emergency department, and to take that advice seriously. I think those are the most important points. And then also not, to do everything you can to keep yourself healthy, what we talked about earlier, getting good sleep, eating as well as possible, getting physical exercise, but in a safe manner, and not try to follow remedies that you may be hearing about in the news or reading about in the internet unless they're recommended by your medical provider. So taking medications that may prove to be useful, but may also prove to be harmful for coronavirus, that should be done only in consultation with a doctor, oftentimes for patients who are hospitalized who need those therapies. Because if people in the community start trying different treatments that are in short supply, they won't be available for some of the sickest members of our community when they need them.
Thank you. Thank you for that takeaway. It looks like we're coming to the end of our chat. So thank you to our audience for joining us today for this great discussion. It's obviously great to have your expertise, Dr. Ayanian. Thank you for being such a good sport and coming on in this slightly different format. For more information and resources to help navigate this difficult time, please visit uofmhealth.org and click the coronavirus links right on our front page. For the CDC, which we've mentioned a few times during this call, visit cdc.gov. That's www.cdc.gov and click the